Hello, and welcome to Health, Happiness, and Harmony Training. I'm Dr. Rick Chambers, and today we continue our series looking at the relationship between addictive behaviors in certain critical areas of the prefrontal cortex. Last week we were separating actual intoxication from this disengagement of the prefrontal cortex. This week we're looking at the difference between actual coping skills and the feeling of release and freedom associated with the disengagement of these areas of the prefrontal cortex. There are many satisfactions in the normal world, such as achievement, relaxation, family, and closeness. But normal world satisfactions require tolerating the stress associated with responsibility, judgment, and caring. So anytime we're approaching problems in the real world or achieving in the real world, we have to keep one foot in the world of stress. But after a person has experienced this disengagement and feeling of release and freedom, they can often feel something is missing or not quite right about the regular world. That is why sometimes the substance is called their fix, or is experienced as like fixing something, because it's a more absolute freedom. So why is addictive behavior often understood as poor or inappropriate coping skills, or as a substitute for coping skills? Outside the actual physical withdrawal, the craving is not so much for the substance itself, but for the experience of release from past, present, and potential negative feelings. Coping skills require remaining aware of and tolerating manageable amounts of discomfort and negative feelings, and especially the ability to reduce the risk of not yet present negative consequences. Coping skills are a usual way to avoid, minimize, or manage negative feelings. But again, this is different from this experience of release. Even individuals with high levels of resources and a range of coping skills can have trouble resisting the craving for release and freedom experienced with the prefrontal off trigger. But imagine someone facing chronic social stress, such as poverty, high rates of violence, or war. Imagine someone facing chronic biological stress, such as chronic pain, an anxious or depressed brain. Imagine someone facing chronic interpersonal pain, such as domestic violence, high verbal expression of anger, abandonment, and loneliness. The idea that these stressors are chronic provides a tremendous incentive to try to escape or find release in some way. Coping skills are learned over time through family, educational, and community systems. But imagine individuals with very little opportunity to learn or problematic learning of coping skills. Their first experience with any relief at all from negative emotional experience may be with a substance or activity that switches off the prefrontal cortex. A reverse perfect storm may be someone overly protected from negative consequences of behavior because of overindulgence, low accountability, or the insulation provided by money or other resources. So rather than developing skills to manage stress or address problems, the behavioral coping skill could become how to acquire the substance or experience that cuts off the part of the brain that can worry and care.